Hello everybody, my name is Ben Hermanson and today I'm going to be doing my presentation on motivational interviewing in the setting of diabetes. Specifically today I'm going to be talking about some of the more psychological aspects of diabetes management that individuals experience, such as depression and something called diabetes distress, which we'll get into a little bit later on in the presentation. Today will go as follows. First we'll start out talking about the American Diabetes Association Standards of Medical Care, what the ADA has said about motivational interviewing and its application in this disease state. Then we'll transition into some of the research that has been done on diabetes using motivational interviewing in reducing diabetes distress and depression. After we review those articles, then we will conclude with some remarks at the end. So looking at the 2023 Standards of Medical Care that has been released by the American Diabetes Association, these recommendations express that behavioral interventions, which did include motivational interviewing, were found to be helpful with individuals in developing positive health behavior routines and self-management of diabetes. Motivational interviewing was found to be beneficial in overcoming barriers to that self-management. For youth with diabetes, they recommended multi-component behavioral family-based interventions, which includes personalized goal setting and planning with family. So a lot of motivational interviewing principles were recommended with those in those populations. And then another thing that I thought was interesting, they pointed out that the use of telehealth was recommended as a safe and effective means of delivering motivational interviewing for those individuals with diabetes. So even using it in different mediums instead of a face-to-face encounter was still found to be effective with using motivational interviewing. And one last thing that the American Diabetes Association pointed out in the Standards of Medical Care that I thought was interesting was a call for providers and practitioners to use what they termed high quality diabetes self-management education and support, or DSMES. This is something that's been recommended for years, but they put some specific definitions to what high quality DSMES entails. They said that this has been shown to improve patient self-management satisfaction and glucose outcomes. They said this DSMES standard should call for an integrated approach that includes clinical content and skills, but also incorporates behavioral strategies such as goal setting and problem solving, and then engagement with psychosocial concerns and emotional regulation. And so I think there was more of a push here to include more aspects of that motivational interviewing as part of the self-management education and support that's provided by practitioners. Research that has been done in this population. The first study that we're going to outline was a 2018 randomized controlled trial that looked at something called diabetes distress. The researchers defined diabetes distress as the hidden emotional burdens, stresses, and worries that result from managing a demanding chronic disease like type 1 diabetes. It says diabetes distress is very prevalent, with 42% of adults with diabetes manifesting elevated levels. It is distinct from clinical depression. It tends to be chronic rather than episodic and has been associated with poor glycemic control and problematic self-care behaviors. So what researchers aim to do is figure out what interventions would be the most effective at reducing distress symptoms in this population. What they looked at were two specific interventions. One was a more education-based intervention where they looked at self-management skills and providing the tools and resources to help individuals better manage their diabetes. And then the other arm incorporated more emotional regulation skill development. And this is where motivational interviewing was more applied, was in this group. So they had two groups. One was called the Know It group, which was the education group. The On Track group was the emotional focus group, where they incorporated motivational interviewing. For ethical reasons, there was not a non-intervention control group because they didn't want to leave highly distressed individuals without any intervention. This was conducted over a period of months of 1-hour online meetings where they incorporated these skills, and then data was collected to reduce on how these interventions reduce distress symptoms, and also they looked at blood sugar control. So the results of this study were that actually both groups, they found improvements on reducing diabetes distress in individuals. The on-track or emotional regulation group was found to have more favorable effects on individuals that had high levels of diabetes distress. So concluding remarks from this study was that integrating motivational interviewing principles along with diabetes education can have some profound effects on reducing diabetes distress. Was a 2020 systematic review and meta-analysis. 121 studies were examined looking at the effects that motivational interviewing can have on specifically depression on individuals with type 2 diabetes. Interestingly, only 8 studies met the criteria to be included in the meta-analysis, but the results found that motivational interviewing was effective for reducing HbA1c, but not for depressive symptoms. One thing that I thought was interesting diving deeper into this one was that there were 4 reviewed studies that had statistically significant improvements in depressive symptoms, but I guess it wasn't enough to convince researchers to include that as an indication. And then the last research study that I wanted to get into, again, looked at reducing diabetes distress. This was a randomized controlled trial done in 2020, where they looked at adolescents that were in Chicago and San Francisco. The average age was 15.7, and they sampled 246 adolescents in the area. Again, they had 2 different intervention arms. One was education promotion and skill development, while the other one was more of a resilience promotion, and that one incorporated more motivational interviewing skills and techniques. Again, they found that that was more effective at reducing depressive symptoms and diabetes distress, even 40 months post-baseline. So goes in line with previous research. Just in conclusion, based on the research that we reviewed today, it does seem apparent that motivational interviewing has a place in reducing diabetes distress and depressive symptoms for individuals in this population.